All right. Hey, everybody. It's Katie Harris, owner and CEO of Nursepreneurs, and I am here with Zach Derby, who is the owner and founder of Exomed.
Of Exomed, yeah.
There you go, Exomed, which is what we're going to be talking about today. And Dr. Roselli is coming on. He's the medical director for Exomed, and he's having a little technical difficulty. So when he gets in, we'll get started, but you can always type your questions. And Arjun, I would just ask, on the sidebar, you can see there's comments. There's it says comments and private chat. If you see people typing stuff in comments, if you could just let us know if it can wait or if it's something that we're going to talk about, that's fine too. But once I go live on the PowerPoint, I can't see the comments anymore.
All right.
And then I guess you'll just have to let me know when Dr. Roselli gets in the room, because once I go share the screen, I can't see anything, which is the downside of StreamYard. But very excited. Zach, before I put the PowerPoint up, do you want to give us a little bit of background about you and why you started Exomed?
Yeah, definitely. So my brother AJ and I founded Exomed. We were both former football players. I played tight end at the University of Iowa, and then AJ finished up his career at the University of Arkansas playing tight end, and then played in the NFL for 5 years. And we kind of fell into the exosome world because somebody reached out to AJ to take it through the NFL Players Association, which kind of got us down the track of figuring out what it is, how you can use it, what the applications are, and ended up getting a distributorship for the company that the NFLPA's HRA plan will actually pay for the athletes to do exosome therapy. So yeah, once we kind of learned about that, we did a deep dive into the internet and whether there's a lot of information out there, which is why this education like this is key to find people like Dr. Roselli, who's using it in his practice all the time.
Hello.
Yep.
Here's Dr. Roselli. Perfect timing.
That was perfect timing.
Well, that was a lot of work.
It's not supposed to be. It's supposed to be easy.
I don't use Facebook, so I had no idea what my password was.
Oh, if it asked you for your Facebook, that's terrible. Yeah.
Sure
okay, that's weird, but all right. So I'm going to go ahead and share my screen, and we'll get started.
Okay.
So awesome. There we go. All right. So so what Zach was just talking about, why he started Exomed, is this field of exosomes, which is basically revolutionizing the wellness area. And we're going to be talking about integrating exosome therapy into your growing business. Zach, I think the last time we talked, you had mentioned that the search for exosomes alone was up like a ridiculous amount, like 1,000%, 5,000%.
Yeah,
so
we saw 1,000%. Before you move forward, you want to make that full screen?
Is it not full screen?
No,
they see it full screen. You don't see it full screen.
Okay, sorry.
Yeah. Oh no, you're right. You mean my PowerPoint?
Yeah.
You can read it.
Yes. Perfect.
There we
All right, that's better. So the search is up, and exosome therapy is definitely gaining traction. A lot of people are interested in it. We're going to hear from Dr. Roselli in a couple minutes, and he's going to talk to you about his practice too. But, it's being used for everything from like inflammation to chronic disease to regenerative use to repair of damaged tissues and arthritis, muscle injuries. Dr. Roselli, how else do you use exosomes?
I like it, like I said before, for neurological injuries, the CTE, and I like the gels and the aesthetic portion of it right now.
Yeah, I love the research.
I think there's so many. And just another side. I mean, a lot of these things are anecdotal, but I took my second dose, I think I told you guys a couple weeks ago, and my vertigo, which I've had for 30 years, it was 99% gone.
Wow.
I don't know if that's from, that's the only thing that changed in my life was taking the exosome.
Well,
I
that's
can
pretty
sleep
amazing.
I can sleep on my left side, which I haven't slept on my left side in about 2 years.
That's awesome.
Like I
So,
said, it's anecdotal. We're gonna hear a lot of stories over the next couple of years on these things.
yeah.
Because there's so many ways it could help. So I think it's kind of interesting.
Yeah, I mean, there's a lot of research that's, I know the University of Penn here in Philly is doing research on exosomes and psoriasis, and there's stuff going on in the stroke world, replacing exosomes potentially for TPA, which is really exciting. So it's not kind of like a fly-by-night science. This is deeply rooted. And people will pay top dollar for exosome therapy. Exosomes are very expensive, and we are going to get into that. But for hydration clinics, med spas, wellnesses. This isn't routinely offered. This is like specialty places that are offering it. It will be. This will be something that's coming. That it's going to be. Everybody's going to want this. The more it gets known, and with the searches up, people are looking for places that offer exosomes, and they're looking for experts. And one of the reasons for doing some of these webinars is to educate you. There's a good chance, like I just learned about exosomes in the last 6 months, like never even heard of them before, and now I'm like knee deep in this, just loving this area and the potential for this area. So if we're just hearing about it, then there's a ton of education that needs to be done on the public front. But this is definitely an opportunity you don't want to miss out on. That's why we have Dr. Roselli and Zach here to talk about this. With 5,000% increase in searches and very few businesses offering, it's a huge, huge opportunity to be in that market. It's a fast-growing market, and you want to position yourself as somebody that's been in the market for a long time. So by the time people are really, really looking at this, there's you'll be like, well, I've been doing this for years, and you'll stand out. There's, what Dr. Roselli told us about one physician who actually charges $100,000 for full body injections, which, that's not what we're talking about today, but just to show you the amount of money that's out there in exosome therapy. So our goal here today is to understand what exosomes are and how you can use them in your clinic. And we're going to talk about what they are, how they're being used, things you need to know before purchasing exosomes, and how to market and price them. So, and this is a nice service line that doesn't require you to spend any money up front until you actually have a client. Now, Zach, you had mentioned yesterday that there's certainly clinics out there that are stocking up on exosomes, but they already have a client base. So if you don't have that, you can sell the service first and then order the exosomes, and they literally come overnight. So people don't have to wait too long for this kind of stuff. For those of you that don't know me, I'm Katie Harris, owner and CEO of Nursepreneurs, and I want to introduce Dr. Roselli, owner and medical director of Revital IV. Dr. Roselli, you want to tell us a little bit about yourself, why you got started, how you got into exosomes?
Good afternoon, everybody. Yes, my name is Matteo Roselli. I'm a board-certified anesthesiologist. I was chief of anesthesiology at Jupiter Medical Center for 23 years and also chief of surgery for 6 years. I started Revitalive about 8 years ago. I've been doing wellness probably about 15 years. I was interested in a lot of this because my wife has celiac disease, so that really triggered me to help, find some type of, safe modalities for her besides, just basic medication that really wasn't working for her. So I extrapolated on my wellness background from being an osteopathic physician, and I started hormone replacement therapy. I started IV therapy, and it's just been steamrolling. So if people that are listening to this, have been around for 2 years, 5 years, 20 years, they can see the timeline of how regeneration and wellness has changed, the landscape of medicine. I mean, if you think about it, 10 years ago, we pretty much just had hormones, which were kind of taboo, and now hormones are mainstream. Then we had peptides. Peptides were taboo, and now peptides are mainstream to the point where, FDA is giving them to big pharma because there's so much money in that. So to me, exosomes are the next step in regenerative medicine and wellness. So it's just showing us so many different modalities that we can have for our patients besides, the basic things that we really only had a handful of things to offer them. And now we really have a lot of things. And exosomes is, to me, a tip of an iceberg, because it's just something that is everybody is finding ways to use exosomes. I mean, there's so many different ways, neurological, regenerative, for ailments, CTE, aesthetics. I mean, there's so many reasons, and it's only going to keep going because, we're opening a door that I think is a great door to open, because it's not only going to help our patients, but going to help ourselves and our families going forward, and, just help people have better lifestyles.
Yeah, absolutely. And I always say, like, if my arm was like falling off or something, absolutely going to the acute care hospital, right? Like I believe in the healthcare system for acute illnesses, but for wellness, I really focus on wellness clinics that are out there, because I think if you want to live a long, healthy, strong life, you're not going to find it in the hospital system.
No. I see it every day in the hospital, and this is the opposite. This is totally opposite of what I do in the OR. It's just, I'm fixing things, but here I'm trying to prevent things, or, just make people have a better quality of life. I don't look like my grandfather. I'm 59 years old. I don't look like him at 59. He looked 90. And I think
Right.
a lot of us that are taking care of themselves in this way, getting sick and injuries and stuff, that's something we can't stop. But, being preventive and giving ourselves opportunity to, we might still only live to 85, but at least the quality of our 85 should be a lot better than our grandparents were.
Yep, absolutely. So, what we're going to show you in this presentation is we're going to talk about, what exactly the exosomes are and why you should care about them. Then we'll talk about how they're being used, and then what you need to know, particularly around the marketing and positioning of this, because even though exosomes have been around actually really forever, they're new to it's new to the general public, it's new to providers, and we have to be very careful about marketing this type of service. So, Dr. Roselli, you want to walk us through, like, what are these exosomes and what are they doing?
Well, communicate from cell to cell. So if you look in the picture, they're called MVBs, microvesicular bodies, and they're made in the cell. They're evaginated from the cell, and they transport to another cell and communicate. So for instance, if a cell is communicating, regrowth, like if you look at your belly and you have maybe a couple pounds, that fat and that tissue there is not there forever. That tissue is constantly changing. Even though you might have that belly around for 5 years, that amount of fat is constantly changing. So those cells, those MVBs, are sending communication to other cells to destroy the fat and regrow new fat, or regrow cartilage and fix new cartilage. So that's how they work. So, we get them from Wharton's jelly, which is from the umbilical cord from a fetus and a placenta. And they are cultivated where the stem cells are giving off the exosomes, and the exosomes are being cultured. So they give information to cells, which is giving them the ability to fix, grow, change, any other adjective you want to use in our body. And last note there, they're very tiny, of course, and they go past the blood-brain barrier, which is really amazing, because it helps with CTE or any other type of neurological conditions like Parkinson's, Alzheimer's. So, success, 3 or 4 patients with Parkinson's, and it's just been game changing for these people, and it's kind of very it makes me feel good that I'm able to help these people by just giving them an IV infusion of an exosome.
Now, the exosomes from the Wharton's jelly, I mean, what is the significance of that? Like, why use that as opposed to, like, how we use PRP, our own PRP?
Well, if you think about it, we're getting cells that are being used to make a fetus. I mean, these cells are all non-differentiated cells. They were involved in taking it from and reproducing cells to the point where you made a fetus that is everything is going through that umbilical cord. So the Wharton's jelly has all the non-differentiated stem cells that are fresh and new. They're not aged. So our stem cells, if we take it from our abdomen, or they take it from plants, or they take it from any other ways, which really aren't that helpful, they have limited success because we're taking a 70-year-old man's stem cells from his abdomen, but they're 70-year-old stem cells that don't have as much non-differentiation in them to do what they need to do. PRP is great. It has its own modalities that I think that it fits, but this is the next step. I don't think people really should use PRP anymore because this is the better alternative to it. These are fresh, non-differentiated cells that are ready to work instead of old cells that, you're not really never going to take stem cells from a 7-year-old to do a PRP for them. I mean, that would probably be a great alternative, but we have these that are cultivated and literally perfect for what we need them to do.
And is there any chance of transmitting disease with the exosomes?
There's always a chance of everything, but these are all tested. I mean, numerous times, certificate of authenticity. They're really good company. I don't really work with any other companies, but this one I know does extreme due diligence where they get the stem cells from, testing from it. So it's they dot the I's and cross the T's to make sure they're perfect.
Okay, can you talk a little bit about, so I feel like stem cells were all the rage for, a while there. How are stem cells and exosomes different, and are we still using stem cells, or do you think the exosomes hold more promise?
Well, the stem cells, exosomes without the stem cells. So once the stem cells are cultivated from the Wharton's jelly, then we take the exosomes from the stem cells. So we're doing the next step. So if I gave you a stem injection, stem cell, treatment, the stem cells would have to release the exosomes, and the exosomes then have to do the work. So we're doing the next stage for the body. So we don't have to put the stem cells per se by themselves. Like you said, with the big rage, but now the exosomes are the MVBs from those cells.
All right, awesome. So do you want to tell us the story about what happened here?
This is a friend of mine about 2 or 3 weeks ago, and Zach and this frantic. His girlfriend was taking a pot oven and obviously burned herself with hot oil. So he called me up. I go, these pictures don't look as bad as it did in person.
They look pretty bad.
I offered the exosome gel, got it the next day, and as you can see the progression, that progression was literally less than 2 weeks. She had no scarring as of now. You would never even be able to tell that she was burned that bad. I mean, there was probably 3rd and 2nd degree burns, which, otherwise I would have, give the old school with putting silting cream and, gauzes and cool compresses. But I just omitted that, and I just gave her the gel. I told her to use it at least twice a day. And as you can see, by day 12, I mean, she has no scar. And she's extremely happy. And now she wants it for her neck and her face. So she's a big exosome fan now. And I think her husband's happy because he didn't have to go through, all the problems that we thought were going to happen with someone having 3rd degree burns, which could have been significant and damaging for someone who likes to look good. So I thought it was a great idea to try this, and as you can see, it worked out perfectly.
Yeah, I mean, how long would something like this take to heal without the exosomes?
3-4 weeks, but don't forget, healing doesn't mean looking like this. It still would have been without a scar.
Yeah, absolutely. Yeah, no, I mean, I think it looks the clear up of that is absolutely amazing, and
And
especially
even,
just having
it even helped with pain also. The pain really subsided pretty quick once we got
really.
on. Actually, that day, she said the pain went from, a 10 to like a 2 or 3. And, I just told her she just needed Tylenol, and that was pretty much it.
Well, now you have a client for life.
Oh, she just, I ordered more for her today, and she's just so happy.
That's awesome. So just to kind of recap here, the exosomes are small extracellular vesicles. They're very small. They're released by all different types of cells. They contain various bioactive molecules. They facilitate that intracellular communication between cells, and they are used for a host of medical and therapeutic purposes that we're going to talk about. But they hold promise in regenerative medicine, cancer therapy, diagnostics due to their ability to carry and deliver specific biomolecules. And they can cross the blood-brain barrier, which makes them ideal for any neurologic condition, and especially stroke, which is what I did for 20 years, work with stroke patients, and we had absolutely nothing good to give stroke patients. So this is like a ray of sunshine and hope in that area. All right, so do you want to talk us through the different ways that you can apply exosomes? How can they be given?
The most common way that I've been using them is the bloodstream IV. Some surgeons that I work with that I'm trying to become, disciples of exosomes like we are, local injection directly into the joint. That's a very, very easy way to, administer them directly to the site, and topically, which I've been, like we just talked about, I've been using. I only see that growing. The benefit, I think, of this is the ease of using it, and I think it's almost like cheating, because we give it IV, we give it topically. I mean, it's just simple, and it's given all of our physicians and nurse practitioners an opportunity to do something where it's not labor intensive to do. And IV and topical is so simple.
Yeah, it almost doesn't feel right for it to be simple and easy.
Right. It's usually not that easy for us, but we think we finally got a break. I think this is one of the breaks that we got.
No, I like this description. I don't know which one of you wrote this, but when you inject it into the bloodstream, it's kind of like, well, where does it go? How does it know where to go? And you guys wrote the description, a heat-seeking missile, and I think that's a great analogy, because how do the exosomes know what to treat?
Yeah, how did it get to my cochlear? My vestibular canal. I mean, I don't care. I'm just happy that I'm not spinning when I'm trying to putt. It's not fun to putt a 3-footer when you can't really stand still.
Right. So, I mean, especially when you're talking to patients, and I imagine they'd want to know that as well. But, whatever ailment the body has, I'm assuming the exosomes are going to target that. Maybe they didn't just target your vestibular apparatus, and maybe it did other things too that you're not aware of that you needed help.
Yeah, I know for me, at least in personal experience, I had shoulder and back issues, and it targeted both of them. And I'm sure there are other effects that it had in my body, but there were noticeable effects with that. And I mean, we're at such an early stage in the research that we don't necessarily know why they go to where they go. We just know that through the vast experience and amount of times we've done it, they target our problem areas, whether it's just because they know there's inflammation there or whatever it is. They just seem to find their way to the areas that need them every single time. As long as it's an indication that we can see positive effects in, we see results.
Yeah, I mean the topic. Go ahead.
I just think the information is just going to keep streaming in, and I think we're going to hear more stories and more studies being done, especially like you said with stroke. If it becomes a mainstream to give X amount of exosomes for every stroke patient that comes in post TPA or post intervention, I mean, it can make a big difference. I mean, just like when a cardiac patient comes in, they ice the patient up, to save brain. This might be on a list of things that you do instantly.
Yeah, I mean, we were like one of the biggest cerebrovascular centers, and we injected TPA directly into the vessels through angiogram. But I can totally see this working amazing. Like just that. I mean, you might not even need to do that. Like that whole specialty might disappear if they can just inject it and it just knows where to go. It knows what to do. But yeah, so, and the topical is yeah, I think this has been used quite a bit, and it's much more, I would say, if anything is standard, that the topical application has been around for quite a while, and it's very much accepted. I think the IV and the local injection people are maybe a little standoffish with, but the topical stuff has been amazing. All right, so where do these different exosomes come from? It's not just Wharton's jelly.
Bone marrow, I really don't see that. Adipose tissue, like I said, really doesn't make sense at this time. And plants, I'm not sure. I mean, Zach could probably elaborate on that. I just don't see. I've only been working with Wharton's jelly. I probably only would work with Wharton's jelly. Bone marrow, again, it could be from an old person, and you're not going to get it from a 5-year-old, of course. So I don't see any validity in using old stem cell for this type of treatment that we're looking for.
Yeah, some of these other like bone marrow, fat, and plants are places where certain other exosome companies are getting their exosomes from. And I mean, Dr. Roselli kind of hit on why you kind of have to be careful with some of those, because really, if we're trying to sell something for a high dollar line item on their visit in, we want to see results, and making sure that the quality of the exosomes that you're using is at a high level should be, something that you guys pay attention to. And something else to point out from kind of the earlier discussion is exosomes will work as well as the source that they came from. Your body already has exosomes flowing through your body, but they're just communicating the message of whatever cell they came from. And the Wharton's jelly exosomes that we use come from the source Dr. Roselli hit on, where it's the highest growth factors and regeneration because of they were in the umbilical cord growing a baby, and we're just giving that message to the cells in your body to really kind of almost reset the clock and get you, like in that burn victim, she healed like she was a 2-year-old. Like a 2-year-old cuts their elbow, they're healed the next day, compared to an 80-year-old that, God forbid, they might take 6 months to heal, and if ever, sometimes.
I mean, you can elaborate on that comment for, besides burn victims, wound healing. I mean, this is going to be game changing for wound healing. People that have decubiti or, diabetic, vascular problems that are trying to heal things. This is game changing, because it's going to help these people from having these comorbidities that your heart surgery went well, but you died from your foot wound. So this can definitely. I mean, we all see that. Somebody has a heart surgery, they die from their Foley infection. I mean, it's just this will change healing with hyperbaric chambers and wound healing from wound clinics. I think this will be a mainstay.
So is there any concern that there'll be like a shortage of exosomes once it gets really popular?
No, not from the company that we work with. They have plenty of there would have to be like astronomical growth before we run into an issue. So yeah, we're all good on that front.
And just to finish off an elaboration on where they get the exosomes from, sadly, in every profession, and especially medicine, there's always people taking advantage of situations, trying to get cheap products and sell them for a high price. And I think that's why it's so important to do due diligence on, if you use this company or any other company, is just to please make sure you're getting the best quality for your patient, because it not only affects the patient, by not getting the results, but it hurts the I guess, the word of mouth about a product that, really is a good product that, people are going to try to take advantage in some way.
Right. Yeah, no, we had that issue, especially in the semaglutide world, where people were buying like the cheap research only medication, and it's not even designed for human use, and they're selling that. It's just it's awful what people are doing. Yeah, and it's really your responsibility to look into working with high quality partners and knowing what to ask, and knowing it's kind of like, when the IRS comes and they're like, just because you didn't know isn't an acceptable excuse.
Oh, that's a great analogy. Great analogy.
So you want to know where the exosomes are derived from. You want to know if they're authenticated, who's doing the authentication. Now, can you talk a little bit about the difference between, I have a slide, I think, on 361 and 351A, what this means and why it's important?
Yeah, I can take that one. So 361 classification is kind of a broad classification that the FDA gives to a bunch of different things like PRP and it's human cells, tissues, and cellular-based tissue products, which like PRP, biologic products, there's like grafts, there's a lot of stuff that's in there, and exosomes kind of fell into it. And the FDA was planning on regulating some of the exosome products that people were starting to put into it, and then COVID hit, and all of their focus got taken into COVID. But that's where all the other exosome companies that we've seen are under that 361 classification. The company we work with, Dynacord, is in a 351A classification, which they are going down the path to become a biologic drug. So they already have their drug master file, which they're the only exosome product with that in the country. And that means that the FDA has came in, verified their entire production process, like where they're getting the Wharton's jelly, how they're doing it, how they extract them, XYZ. That whole thing has been approved by the FDA. And they needed to do that prior to being able to do their clinical trials, which they're doing right now. And so basically the reason we liked this company was because of that, where we know that this vial of exosomes is going to be the same as this one, it's going to be the same as that one. Because if we're going to put our name behind something, a product, we want to know that, we're going to get consistent results and be able to, see that consistently. Does that make sense?
Yeah, absolutely. And that is reassuring, because I know there's one big exosome company out there that's, actively fighting with the FDA and then constantly getting letters from them, and they're shutting down their processes and stuff, and they keep going. And it's really kind of scary, to see that happening out there, and then fighting so much with the FDA and having their product, devalued. And yeah, I mean, you just don't want to work with a company like that. All right, so some things to consider. Were the exosomes ethically sourced? Where did they get the Wharton's jelly from? And so the umbilical cords that you guys get, I mean, these aren't aborted fetuses or donate. What I mean, how are they sourced?
They're all donated from C-section births at the University of LSU's hospital. Dynacord's partnered with the university in order to do that. And every single mother has been pre-screened for basically every major disease, as well as the COVID vaccine. So that none of the mothers have any of that, and they've agreed to donate the Wharton's jelly umbilical cord for the exosomes. Yeah.
Okay. And then we talked about quality versus quantity, because there's some exosome companies out there that are boasting about like trillions of exosomes, but that's not necessarily a superior product just because there's more. Can you talk about that a little bit?
Yeah. So when you spin the exosomes out, you can continue to spin and get a higher count, but if you overspin it, you can damage the exosome and the cargo that's in them. But the reason companies do this is because they can raise their profit margins, as well as, just you think for marketing purposes, if I can do 10 billion exosomes versus a trillion, everyone is going to think the trillion's better.
Right.
And so because the Dynacord is going after, the clinical trials, going down the route of trying to get FDA approved, all they care about is potency and the product working. And they can't even market right now. So they're just trying to create the best product they can do. Which is, that kind of, you got to be careful kind of what you see, because it's still at such an early stage that, from the outside looking in, I would think trillions are better than billions, but this is one case where it's not.
I tried to count them, but I was trying to count them, but it took a while.
Yeah.
So I don't think, they can easily say it's trillions, but to me, that's reputable also. Who's going to sit there and get an electron microscope to see how many
Right. Yeah, so you can also get a COA with certificate of analysis, and that should be readily available. If somebody doesn't want to give it to you, it should be a concern. You want to know who you're supporting.
That's a key, third party. A lot of people do their own in-house COAs, which are
it's ridiculous.
Useless.
Yeah. That's like when I do my own self-assessment. It's just not helpful.
Yeah.
I'm doing great. Yeah, and then the purity and the known supply. You want to work with somebody that's reputable, who cares. Just the fact that this company is going down the path of FDA approval, which is a considerable investment, a considerable of money and an investment of time. Like it's crazy how expensive it is to do what they're doing. So it screams that they're in this for the long game.
Right.
All right, so application, exosomes can be engineered to carry therapeutic agents, which is, something that I'm sure is going to be coming from the regenerative medicine aspect. It promotes tissue repair and regeneration, useful for treatments and injuries and degenerative diseases. There's a role here potentially for cancer therapy. Just a lot of stuff that's going to be coming down the pipeline. And then, of course, the cosmetic applications, topical treatments for help promote collagen production, cellular turnover, anti-aging, used in creams and serums, and especially in the wellness and alternative therapies to improve overall health, reduce inflammation, boost immune responses, fix your vertigo, and whatever you have going on. Can you tell us a little bit about what happened here?
Yeah, so I was closely involved with this one. This actually somebody I know, and got in contact with their podiatrist, but they had they're diabetic, neuropathy, smoker, obese, basically everything under the sun that you shouldn't be. He was. He had these wounds on his feet that wouldn't heal. They've done everything from grafts to you name it, and in 3 weeks, the wound had closed. It has since completely, you can't even see it, notice it's there anymore. But that went from something that person had for years to being, fixed in a month from daily application of the exosome gel on the wounds.
That's crazy. That thing looks like it was heading down the road of eventual amputation.
Yeah.
You can even see even the lower leg had more of the vasculitis on it, and it seems to have improved as the.
Oh yeah, you're right.
Side note. That's big to me. You can't fix. The vascular problem will be there unless you get a fem pop or some other weird type of procedure you might need. But at least it's giving them the opportunity for the cells to grow. When you don't have good vasculature and nerve endings, it's hard for it to grow, but the exosomes gave it an opportunity to maybe move a little bit faster, which is obvious in the pictures.
Yep. All right, so use of exosomes are not FDA approved, so you can't make any medical claims, such as you can't say take exosomes and fix your Parkinson's disease or anything along those lines. You do want to definitely be upfront about FDA approval that if you're giving it IV specifically, you can't say it's going to treat, fix, or cure anything. All you can do is tell other people's stories and let them know, basically you can't guarantee that this will do anything for them, to be honest. And I think you have to really hone in on the stories that we have and the research that is out there without making any individualized claims for a specific person, which is really frustrating, especially when you're trying to help people. But we have to focus on education, providing content. This will help you build trust and awareness. And, just have to wait until this becomes more, I guess, once they get the studies. I mean, that's going to be years. But for IV exosomes, pricing generally for people will pay between $5,000 and $10,000 for IV therapy. Local injections, price range, per injection, $2,000 to $4,000. Microneedling as an add-on service. The topical, you can increase the price an extra $500 to $1,000. And I actually do have a couple pictures of microneedling, which are pretty cool. The topical gel, and $90 to $200 per pump. So I mean, you can see, and there's big profit margins built into this as well. But I mean, this is the price range that this is going for. Over-the-counter gel, anywhere between $2,500 and $4,000. So just to give you an idea of what this can do for your business and your patients, right? Like this, right. I mean, if you had that oil when you're just like that, like at $200 per pump, yeah. I mean, what would it have cost her to go to the ED?
A lot more.
Yeah, and she wouldn't have gotten nearly the result that she got with this.
Wow.
So everybody needs a friend on speed dial that has access to exosomes.
Happens a lot.
Yeah, they need your phone number on speed dial. So
everybody notice how so many people call your office and say they're friends with you and you have no idea who they are?
Exactly.
Oh, man.
We had Exomed treated a former NFL player who was recommended a total knee replacement for a career-ending injury in the NFL, had microfracture surgery while playing, never fully recovered, started exosome therapy, and it was a game changer, allowed him to be fully active again without any pain. He now plays basketball, skis, golf, and enjoys playing with his kids pain-free for the first time since injury. Yeah, I mean, I'm embarrassed to say I don't watch all that much football, but when I do, it's like, oh my God.
You can see why.
Yeah.
So I think something like this is to highlight, though. It's a lot of patients are told that they need to have shoulder surgery, knee surgery, you name it, and nobody wants the surgery. And, there's a good portion of people out there that will pay $5,000 to $10,000 to plus $1,000 to potentially avoid surgery.
Right.
Yep.
So those patients like that are perfect candidates because, surgery is going to require 6+ months away from, in this scenario, golf, skiing, being able to move around with your kids.
Besides risk. Risk.
Exactly.
Besides risk.
Yeah. Yeah, my dad's 83, and I did IV exosomes for him because he's been talking about a total knee replacement. I'm like, first of all, you're too old. Second of all, if it gets infected, you're going to die. This is basically what's going to happen because you're not going to do the rehab, and the infection in itself will, knock you out of the playing field. And yeah, he's been doing great. Like it's not, it's not perfect, but he's also not going to surgery at this point. So, we're really hopeful with that. This was one of the microneedling, patient says, I've always been one to spend a lot of time in the sun, put my skin through a lot. I have never done anything that's given me the results that I've gotten from one exosome procedure. It does look really good. Another patient, a 55-year-old hip replacement, having her right side swollen like the Michelin Man, struggling with rehab. She did exosome IV 1 week after surgery, and results were amazing. Like, this is where I see a huge role. Like, I've got a lot of just need surgeon buy-in, to have them send their patients over to me. They have to believe in this stuff. But, I think as more and more of these stories come out, it's almost going to be malpractice not to do this. So within 24 hours, all inflammation from surgery was gone, and I was able to progress through rehab way ahead of schedule, and also back on the golf course. So that's
we're in South Florida. That's what a lot of people do.
A lot of golfing. Another microneedling patient, within 24 hours, all the redness. And my sister had microneedling done. I swear to God, it looked like she had been beaten up in the hood or something. Like, it was yeah.
It takes away the redness right away, also, like an acute anti-inflammatory effect. So it's kind of cool.
Yeah, we use the exosomes now for our microneedling, and it does. Like, I actually did Morpheus. I did my own Morpheus, and then did exosomes over top of it. And after the Morpheus, like, your face it's burning, and that cooled it down like immediately. And the redness was like, I mean, nobody could tell I had.
Nice.
I had just like zapped my face 1,000 times. So, all right. So, we'll get to questions in a bit, but I want to tell you about, the opportunity that's here. I want to talk to you about how you can work with these top grade exosomes and with Exomed, which is the company that's offering these exosomes. And like we said, you want to be working with high quality exosomes, a trusted resource, at a good price. So, unlike other products, exosomes have a wide variety of quality. Exomed is trusted brand working with top name athletic leagues as well. So, I left out the pricing here because Exomed is still working on some group pricing for us that ideally we'll get, within the next couple of weeks, we're hoping for, but we'll have prices for the 5 milliliter, the 1 milliliter, and the topical gel that we'll be able to use, but they will be of top quality, and we will definitely get those prices for you. We are looking at getting group pricing for nursepreneur affiliated businesses. You'll have access to premier discounted rates that you won't be able to get anywhere else, and you won't be able to get from Exomed. So it'll be especially for our group. And so one of the things that we thought we would do is put together a community, because we want to share the wins and updates and the changes in the industry and what's working. And, it's just like having these pictures and these stories, because, I mean, there are some studies coming out, but it's going to take some time. And if you don't have the before and afters that you need to share with clients, having a community that is sharing this information, you can share these stories that we have with your clients to help them to decide if this is what they want to do, if this is what they need to do, if this is, something that's going to be of value to them. The best way to do that is to share these stories, these anecdotal stories. So we thought that, putting this community together, as we all start doing exosomes, we can create kind of like a portfolio, if you will, of before and afters and these stories that will eventually become, qualitative studies, and then quantitative studies, and then clinical research trials. And again, like I said, I think within the decade, it's going to be malpractice not to use exosomes. And then, we have the opportunity, we've been working with Zach and his brother to do infusions. So if you're in that community, as we build out that lead generation program, what we're doing is infusions of the exosomes to the athletes that want them, and we need nurses to do it. So we want nurses that know what exosomes are, that are trained in them, that have expertise in this area, that can work with those athletes. And so that's really in a beta phase right now, but it's, we're working to create like a pretty large program with that within, this year, and have something. We also wanted to create some Canva templates, which we'll do. We'll have some marketing brochures for exosomes to help you. It might be a rack card but you can put your brand on there, your logo, and then you don't have to worry about, am I marketing this properly? Is this legal? Is this, this, that, or the other thing? We can help you with the wording. And then you'll just have it so you can get started with exosomes as quickly as you can. Then the other thing we wanted to offer were just monthly webinars. So we'll, look occasionally to have Dr. Roselli in that group, and, some, scientists and research and marketers and different people to come in to do educational marketing and training, because this field is exploding and there's new information coming out all the time. So that is really what we'll be doing in that community. So you'll get access to the Exomed exosomes, and as soon as we get the group pricing, you'll be able to purchase them at the special price through Exomed. You'll have access to the community where we'll have all of the before and after testimonials, stuff that we can share with each other. That is the group that we're going to be going to for lead generation opportunities. So as the athletes start purchasing exosomes, when we need nurse businesses that specialize in exosomes, that's where we'll be going to, hire nurses to do this, hire your business. You'll get the brochures. We'll actually even throw some social media templates in there. And I've got a couple of blogs that I wanted to share with people that you can use for your website, and then monthly webinars. So the URL, that tinyurl.com/exosomes.nurses is where you'd want to go. This is just a community for right now. There's going to be a ton that's offered in that community, and we're just pricing it at $49 a month to be in that community, to have access to all of these things that we're talking about. This is a big industry, guys. It's exploding, but very few people know about it. Even, as the searches increase, it's still relatively few people. There's a ton of work that needs to be done around education. It's like almost impossible for one person to do it by themselves. You need a tribe. We need a community, and we need to help each other. So you also want to provide high quality exosomes, and we want to support each other's businesses. So tinyurl.com/exosomes.nurses/nurses. And, at the low, we'll grandfather you in at that price. Once the lead generation really takes off, it's going to be a way higher group. But if you join now and help us build the base of this, that's where we'll leave you at that price point, and you'll have access again to the group pricing, the exosomes through Exomed. You purchase them at the group price, have access to the community, the before and afters, the lead generation opportunities, the brochures. Again, we'll throw in some social media templates and some blogs, and we'll be doing monthly webinars. So we really hope you join us with that. I'm going to stop sharing and come back. If I can find you guys. There you are. And let's see what kind of questions we have in here. Holly says, this is really amazing research being done on exosomes. Very interesting. What is the name of the company? Exomed. And how do we set up an account? You want to be in the group, Faith. Lisa Kubiak, is it given IV push, IV, or IV drip? Do you need special tubing?
Nope, just IV push, and then follow up with a 5cc flush to get everything out of the IV catheter.
Yeah, that was anticlimactic too when I gave it to my dad, because it was all this work to put the IV in, and then it was just a push and right out. I'm like, okay, we're done.
You can do it slow to make it grandiose and put some music in the background if you want.
Yeah. Are you feeling? Oh, somebody's trying to sell medical billing on my webinar. Okay. What about insurance? There's always one.
Insurance would pay us $5.
Yeah. That might
be IV. They would never even pay us for an IV. We know that.
Yeah, I was listening to a podcast on insurance on Joe Rogan, and was fully disgusted by the insurance industry. But yeah, no, they're I guess, okay, if your arm's falling off,
Yeah.
but if you actually want to be healthy and well, your insurance is not going to help you. Oh, malpractice insurance.
I mean, you should have malpractice insurance, of course. I mean,
Is there any kind of special insurance that you would need to do something
No.
like this? Okay.
No.
And in terms of like,
a consent form, I would have a consent form, of course.
oh yeah.
Yeah, we sent you guys a consent form.
Is it difficult to get someone to insurance? What do you mean by that, Lisa? I'm not quite sure I understand that question, but yeah, I mean, there's nothing special that you don't give your malpractice insurance a list of infusions that you do. I mean, generally they just insure equipment and stuff, but what about like if in terms of the medication, I mean, yeah, I'm not sure. So let's say the medication comes and it's, I don't know, broken or something. Clearly insurance doesn't cover that, but is there, oh, she said some companies won't insure you if you use stem cells.
Mm. I haven't had any.
You haven't had any issues.
No, I haven't had any problems.
Frequency of dosing. How often is it given?
Depending on the person and what you're treating, I would say if it's neurological, it'd probably be ongoing. Some patients is every month or every quarter. If it's just for like knees or hips or fixing, hopefully, like we were talking about the NFL player with the knee, I would say it'd probably be 3 doses, probably a week or 2 weeks apart. Like again, this is just there's no real numbers to do it, but that's just what I've been noticing.
Well, the NFL player did one IV with 2 5-milliliter vials. We found that 5 milliliters per 100 pounds of body weight works very well. And he's probably 9 months out, still doing great. We've heard people that do follow that protocol. A lot of times, 2+ years later, they're still good. It all depends on the patient though, because all we're doing is sending a positive communication message into the body to tell it to repair and heal itself. And then after that, what you do with your body, how you treat it, just like natural aging, it's going to be different for the different patients. Again, we're at an early stage of this, so we don't have a great for sure answer for that right now.
Correct.
Yeah, I think that's hard, because especially when you're first learning something, you want some like black and white protocols, and we don't have that. What we have are, anecdotal and some random research studies. So you kind of have to, it's kind of an art form right now.
Every person's different. We all know that, just like hormones and peptides. It's just, you just have to do your due diligence when you're doing the H&P on the person and just use the experience that you're accumulating and go from there.
Right. Yeah. And it's, so let's see how often.
If someone has a question, just email me and I can also help them also.
Right. Now, can you overdose on exosomes?
I've never heard of it.
So if I had enough money and I wanted to give myself exosomes every day, there would probably be no contraindication for that.
I would love to take the money on that person. That'd be very interesting.
If somebody could refer that person to me, that would be.
Yeah.
Yeah. All right. So will exosomes be helpful for people who need total knee replacement? I mean, I can see that before to prevent the surgery and or after to heal the surgery.
I see both, correct.
I know a guy, he's probably 65, that had multiple people tell me he needed a total knee. He's on like every 6-month exosome IV plan, and he's great at this point.
I mean, look at if anybody watches football. I mean, basketball. Dwayne Wade, I think in 2014, kept having microfractures of his knee, and his career was going to be over. He went to Germany. You know, they were ahead of us by leaps and bounds then, and never had a problem after that.
He did the exosomes. That's amazing. Yeah. And, you know, I always say, like, in terms of like expense, you know, it's always kind of like, if somebody says it's expensive, it's like, compared to what, you know,
Right.
like, I mean, compared to the rest of his career, I mean, yeah, compared to like living, you know, a healthy life. Yeah. It's, I mean, and especially if you only need it one time, but even if you needed it, you know, I know, once a year. I know some guys, an executive team that does it quarterly, and they love it. Specific dosing based on weight. You said 5 milliliters per 100 pounds.
Correct.
We found that to work very well. Granted, there's no true evidence behind that. It's just something that we found that has worked great. Again, it all depends on how bad the problem area is and
other comorbidities.
Yeah. So there are a lot of things for the exosomes to fix, and is there an awful lot of body mass for it to get through?
Exactly. Yeah.
Yeah. Yeah. I imagine some of those NFL players would. I mean, they got a lot of body mass.
Oh yeah.
All right. Cool.
All right,
yeah. So if you guys are interested, you know, to be part of this, it's you know, a brand new project that we're working on. But you want to go to tinyurl.com/exosomes-nurses, and yeah, we'll continue the conversation in there. I want to thank you, Dr. Roselli and Zach, for sharing this with us today.
Definitely. Thank you for the opportunity.
Bye, guys.
All right, guys. Have a great afternoon.